Well, new tonight, stunning new numbers from the CDC show the majority of kids in the U.S. have been infected with COVID-19 at some point, and that far outpaces the country as a whole.
But what is the reason behind these numbers, and how do parents make sense of them now? Queen City News anchor Ryan KRUGER joins us in the studio to help break them down. Ryan?
Yeah, so Brian and Alicia, an estimated 140 million Americans have had COVID-19 since the beginning of the pandemic. That's a little bit less than half of the total population. All of this according to the CDC. The age group that has been the most infected by far, though, that's kids 17 and younger.
They were the last age group eligible to get a COVID-19 vaccine, and now new numbers from the CDC show nearly 60% of kids under the age of 17 have been infected with COVID, compared to less than a quarter of all senior citizens.
Thankfully, children continue to do quite well with COVID, although there have been several hundred deaths in children in the United States, generally in children who have other medical problems.
In North Carolina, there have only been 22 kids under the age of 17 who have died from COVID. But health experts say it's not just deaths and hospitalizations they're worried about, particularly with kids.
We're really just now starting to get a good understanding of the effects of long COVID, and we really have many more years to go before we really understand it even more fully. So patients, both young and old, they may not be as fortunate in their recovery.
While they may be the most infected age group, kids under 17 are also the least vaccinated. Plus, kids under the age of 5 still aren't eligible for a vaccine. Health officials say even if your kids have had COVID, they should still get vaccinated.
We know for sure, and there's a lot of good data that shows after getting a natural COVID-19 infection, some people get that long and strong protection. Some people, it's pretty weak and it's pretty short and it goes away quickly.
And one other thing that could be adding to the rise in cases in kids, new research is now showing that the Pfizer vaccine isn't as effective in preventing COVID infection for kids, particularly aged 12 and younger, versus the protection you get as adults. Brian?
Yeah, a little bit more disturbing information, but thankfully COVID on the decline right now. Ryan, thanks.